So I'm Angela, and I'm the owner of Cancer Rehab Austin, and I'm happy to have our other collaborators here. My vision and the reason I opened Cancer Rehab Austin was because I felt like people were going into the hospital setting and dealing with side effects of cancer treatment and chronic pain, and that was not the most healing environment for people. I feel like we had to remove ourselves from that clinical setting in order to completely heal. I also know that I was always referring out to multidisciplinary clinicians such as acupuncture and massage therapy, dietitians and yoga and Pilates. And people are stressed out and have so many appointments when they're dealing with cancer or dealing with any chronic diagnosis, right? And so they're driving all over town trying to get the care they need. So I had a thought, why don't we bring it all to one place? Why don't we take it out of the hospital setting, get rid of those white coats, and just, have it all about the patient-centered care with a multidisciplinary approach. So that's been my vision, and I was really excited to reach out to my favorite practitioners in town, Agnes with acupuncture and Jerry with oncology massage, and just bring up this vision and see if they wanted to join my team. And I was completely honored that they decided to join in. So, yeah.
We've all given talks together over the years, sitting on different panels, and I think what became very clear to me early on is that we all share that same philosophy and idea of, from what I hear from a lot of patients, is as a cancer patient, you get kind of separated out, right? You go to your surgeon, you go to your oncologist, you go to your radiation, you have all these many nurses, and you feel like you get kind of pulled apart, and then you get dropped off and you don't have somewhere to land. And I think what we do here that's really amazing is helping to bring those people back together again, helping them heal in not just those specific areas such as dealing with chemo side effects or dealing with radiation, maybe some skin burns, but actually looking at all of it together, figuring out how can we help the immune system to really build back up to help with the fatigue. How can we work with some of the scar tissue to help them have better range of motion and to regain back their quality of life. And that's what I really loved about your vision and your idea, and how we all can work together to help patients with that.
Right. I definitely agree. I definitely agree with all that. I have known Agnes and Angela for many years now, and I was just so thrilled to be able to be part of this, to work with two such wonderful healthcare practitioners, and really the vision, the mission, the goals of Cancer Rehab Austin is just wonderful, and we need more clinics like this in town. And to think that we're the first, and thanks to you, that we are part of this. And I've had people come here and they just feel so, such a healing atmosphere, and they are just so happy to be able to come to one place and to feel support in so many different ways, and then to know that we're all a team here. So we're an integrative team that collaborates with one another, and to help the patients, to help my client, and it's all patient-centered care. So I'm just so happy to be part of this, and I just see it growing. And more of my clients that come here, they're just thrilled that it's a quiet, healing, calming environment, and it helps with their side effects from medication, from treatment, from the disease, whether they're going through treatment or they're in survivorship or in palliative care.
Right. Yeah, what I hear often is the now what, right? I've undergone cancer treatments. I've really addressed the cancer, but now what? I'm a full person. I want to get back to doing the things I love. Where's the quality of life? So I think our clinic is here from a multidisciplinary approach to focus on that, and to really, the now what is just as important as the let's survive.
Yeah.
Right. Sometimes
Definitely.
scarier even, because those side effects last for many, many years.
Yeah.
Reminding patients to be patient
Yes.
and how long it's going to take them to recover. I think we all see people who maybe are 3 or 4 months out, and they're expecting that maybe their fatigue or their pain is supposed to be gone.
Yes.
And really, it's having a space in a clinic like this where we all understand that, but being supportive in the fact that it is going to take a while, and being there to help them through that, and keep reminding them this is normal. It's going to take you a while to recover. Don't get upset or depressed about the fact that you don't have all of that energy back yet.
Absolutely.
It will happen.
Right.
And reach out to people.
Yeah.
To let people know.
That's true. Yeah.
Because afterwards, I know I've had clients come to me and they feel lost.
Right.
They were taken care of as they were going through treatment, and then all of a sudden they're done with surgery and the treatments, the conventional treatments, and then, they're done.
Right.
Well, now what? Now comes survivorship.
Yep. And knowing that there's a team out there, right? Knowing that there are many
There's some place
practitioners
that
out
they
there to
can
help
go
you.
to. Right.
Right, whether it's diet or acupuncture or massage or physical therapy or lymphedema treatment or yoga, I mean, there are all of these things out there that are working towards the same cause, and which is becoming a more complete person and moving beyond cancer. That's our mission. That's our statement, right? Moving beyond cancer. What now? So,
And people, from what I've heard, is that patients are looking for that. They just don't know where to go.
Exactly.
And I feel like a lot of what we do is actually educate the community that this exists. There are practitioners that are specialized in this, that are highly educated, that have come together to create a space like that because people just don't know where to go. And if you don't know where to go, then you kind of end up falling by the wayside, where there's so many resources out there that could help you get through this so much faster.
Exactly. And there are a lot of acupuncturists, and there are a lot of massage therapists and physical therapists. So how do people know what kind of specialized education do you need, in order to work with the most appropriate practitioner? So knowing that there is advanced training for those. You got training at MD Anderson, right?
Right, and I feel like, Jerry, you do such a great job of making sure to let people know that this clinic does actually have specialized practitioners. We all have advanced training on how to address the specific issues of cancer patients, but also how to make the modifications that are so necessary, how to be safe. Certainly with acupuncture, you have to know where you can needle somebody or not needle someone in cases like lymphedema or edema in general. The body changes a lot when you're going through cancer.
Right.
You swell in different areas that maybe you didn't. You tend to gain weight and then you lose weight. And it's really important to get all that extra training so that you know what to look out for. Not necessarily to just learn what to do, but what to know not to do to make sure that you are being safe and you're taking all the necessary precautions.
Right. I took my oncology massage training in 2010 for 18 months, and since then I've taken more trainings, and it just goes on and on and on. So the education doesn't stop, which is
Never
glad.
Yes.
But and there's more and more people, I think, getting trained in specifically oncology massage, and this is so important because there's more and more cancer survivors.
Right.
And those people are participating in marathons, and they're going to spas, and they're getting facials, and they're in everyday life, and they have the stress, and the anxiety. So when they hear about us here at CRA, they are just like, I know I'm here, I can relax, I know that you'll take care of me in the proper way, in a safe and effective way.
And I think that people come to us and they see us on such a regular basis, definitely for me, is that they're comfortable with asking questions that maybe they're not so comfortable with asking their oncologist about. Maybe some personal things that because they see us so often, that you do develop that relationship with your patients. But I feel like the things that I hear are probably not what they're telling their oncologist or their doctor. I always, if there's something that I notice somebody keeps saying, maybe over 2 or 3 sessions, I make a note for myself, so that when they are going back to their oncologist, I either remind them, remember a few weeks ago you were really having this low back pain, maybe let's get checked out for a UTI.
Right.
I know you're feeling better now, but just bring that up.
Yeah.
And people forget about the way that they felt last week.
Yeah.
But with seeing us, we basically see patients on a weekly basis.
Yeah.
Sometimes
Every other week. It depends on what the treatment strategy is, but we get to hear the things that happen right then and there.
It's more than just a 5-minute session with a medical doctor. We get an hour. We get a length of time with them.
Right.
So we're able to see what they need and help them get the resources that they need in a way that perhaps they can't get in a different setting.
Absolutely.
Yeah. And then one of the worst things is people being fearful of these particular interventions because they just don't know that not only can they be safe, but they make a huge impact. There's so much scientific research on oncology massage, on acupuncture, on physical therapy, on lymphedema treatment, on pelvic floor rehab. And the thing is, people are fearful because they have their new norm and they don't know what's safe to do and what's safe not to do. So one of our jobs here at CRA is to educate the community medical practitioners as well as our clients on it's safe, it's effective, and it makes the world of difference. And you're going to be in a setting where you have highly experienced people, so you're safe.
No, that's a really good point with, and again, it comes back to educating people that this is safe. Certainly with acupuncture, most people say, oh my gosh, all these needles, and they get kind of nervous about it. And definitely with patients who have gone through chemo, where every week they're getting labs drawn and they have the reports, and it's kind of hard to think that you're going back for more needles. But I have patients that come to me that say there's one appointment that they will not miss every week, and that is coming to see us here. It doesn't matter what else they have on their schedule for that week. This is the one appointment that they will not miss. Because it makes such a significant difference.
Yeah, I'm sorry to interrupt. I've had clients come to me during their treatments, and that is what they look forward to. Before chemo or before radiation or after radiation, it's the one bright light. And it's just amazing that it can make such a big difference.
Absolutely.
Emotionally, physically, mentally, spiritually. People talk on the table, they sing on the table, they snore, all different.
And sometimes they cry, and they need that too.
Right.
This becomes a space where it's not just necessarily about helping you with your pain or helping with the nausea or helping with your lymphedema, but it becomes a space where we are able to support people emotionally. And you can go ahead and have a breakdown when you're here because we're here for you, and we will help you through it.
A sacred space.
Yes.
That's what we offer.
And I hear from a lot of people that lack of control when it comes to cancer treatment, and the fact that what they receive here is one of the few times they are in control of this, and they are choosing to receive our care and make a difference, and so that can be pretty comforting for people too. Yeah. So one of the things that we are really blessed to be able to do here at Cancer Rehab Austin is work together in a multidisciplinary way in order to help people with their side effects and their concerns and their decreased quality of life. I know that Agnes as an acupuncturist and myself as a physical therapist, we've really collaborated with patients to work on scar tissue tightness, pain, axillary web syndrome, really communicating with each other, sorting through different treatment options to get the greatest outcome and the greatest result with these clients.
I will say that sometimes it's almost magical because we're able to have that dialogue with discussions on what exactly is happening with that patient today. So there was one particular person I'm thinking of who had some of the scar tissue, the axillary web syndrome. You had seen her, you knew she was coming in to see me, and you said, I noticed this was going on. I quickly was able to say, okay, I know exactly how to treat this. I know what to do next. And then I knew she was coming to see you again. And I was able to give you the feedback of, this is something else that I felt, or this is something else that I saw, or something else that she had mentioned to me. And you were then able to incorporate that.
Yeah, it's pretty powerful. And having worked in the hospital setting, I know that I have already, in the few months that we've been open as a clinic, I have noticed a profound difference in improvement in patients that's a lot quicker with working with you guys closer than we used to when I was, when I was a satellite out in a different clinic. And I'm noticing people are improving quicker. They need fewer treatments, which is pretty significant. So, Jerry, us working together with lymphedema clients has been pretty helpful, right?
Yeah, definitely. I mean, I work with people in their maintenance stage. You take care of them more acutely, and then we talk about that client and help that client go through the survivorship part of it. And it really helps to have that collaboration where I understand where the patient came from and where the patient is today, and then I can modify my treatment accordingly.
Right. Because I usually see the client for the acute phase, that intensive phase of lymphedema treatment, which is called complete decongestive therapy, as you know. And then once I work with the patient during that time and they're ready to manage it on their own, they do need help long term. They'll come to you for that maintenance. They're feeling some increased heaviness and achiness and know they just have to get on top of it again. And, I know I'm putting them in the best of hands when it comes to, literally, when it comes to the manual lymph drainage you can provide them. And then I feel comfortable if you can tell that it's a flare-up or if it's something where they need to come back and see me. I know that you have the knowledge and the skills to understand that. So it's really helpful.
And many times people just want a massage at that time.
Yes.
So I can modify it accordingly.
Right.
So
you can pull out other tools in your toolbox.
So it's very client-centered, customized.
Right.
Session.
Exactly.
Yeah.
Great.
So I've had clients come to me, and I always tell them about Agnes with her acupuncture, which will help neuropathy. Massage can help to some degree, but many times it just helps to have a competent acupuncturist who can work with oncology clients and just help with the neuropathy.
Yeah, it's really a big problem, neuropathy is, and it's unfortunate that more people don't know about acupuncture because it can be so effective, and the sooner that people will come to see me, we can get on some of that numbness and the tingling and the pain that people often have that's associated with their neuropathy, either in their feet or in their hands. A lot of what acupuncture does specifically for this is to stimulate those nerve cells to regenerate. When you're going through chemo, it essentially kills all those nerve cells. But a big component of it that I always tell people is that you have to have increased blood flow. And that is where massage can be so helpful, is helping move that lymph, the blood, so that when you have good blood flow, those cells can regenerate. So working together has really been, I feel like patients, like Angela was saying, patients are getting better faster. And we're seeing results that I think a lot of other clinics don't really see.
And also I tell my clients this is a team effort for them too. So they understand that they have to be somewhat dedicated to coming to acupuncture and massage for their neuropathy. I had one client who for 3 years she was getting chemo and she didn't want her feet touched at all because it was just too painful. But slowly I started to work with her and she just couldn't believe the change. But it took homework, it took teamwork, and and just telling people about acupuncture, how it can be effective for neuropathy is just amazing and very, very, very important.
Yeah, and you were talking about that hypersensitivity, you know, and so I'm working with people when it comes to balance and when it comes to stability with neuropathy. If they can't tolerate the exercises I'm giving them, you know, so sometimes there's that extra level where they need your care first in order to desensitize, so then they can tolerate my balance exercises and safety and working with them on changing their mobility and their mechanics. But sometimes I need help before we can do that. So
that's so true because of that discomfort and pain. People don't want to step.
Right.
They don't want to use their feet. And it's the double-edged sword because if you're not using your hands or your feet, it actually continues and exacerbates the problem. I see the same that you were talking about with that sensitivity, that hypersensitivity, where I'll start working with somebody and they can only handle a limited amount of work. And in my treatments, I've noticed that progressively they can handle more and more and more. And by seeing then Jerry moving on to you, I feel that my time with them, I can kind of pass them along a lot sooner because there's some things that I can't do, like the posture, the balance. Definitely with you, with your massage is so important. I know what my limitations are, and knowing that I have you guys and I trust you, I can send my patients to you is really just amazing to be able to work in such a clinic and space.
Right. It feels like we're giving the best quality care. We don't have those limitations that we would have in other settings.
Right.
It's wonderful.
I love it.
I do too.
I had a really interesting experience with a patient who I have been seeing for a while. And she had started talking to me about this idea of the new normal, right? You hear a lot of patients talk about the new normal. And she had said, you know, I don't really want to have a new normal. I don't even want to be back to what I was before my cancer. I actually want to be better than I was. And you hear that from people, and I find it so inspiring because that is something that I now want to do. Is I want to be able to help people not just be better today, but be better than they were before.
Yes.
And I actually found, I think about that every day and with every patient is how can I help them be what they were? Not just be what they were before, but be better than before. Is that something you guys hear about as well?
Yes. Well, in physical therapy school, we learn to write goals, right? Patient goals, and we work towards them and we document on them. And working with my clients, I realize I want more than those short-term goals, right? I want your dreams. I want what you want to be able to do. And then that is what we focus on every single day I work with you. And it takes time, and we go through our short-term goals and we meet those. But our ultimate destination is whatever the client wants it to be physically or with mobility or any of it, you know, whether it's I want to be able to pick up my grandchild off the floor.
Yes.
Or if it's I want to be able to go skiing, or I want to be in a bodybuilding competition. You know? I mean, those are all valid goals, and you shouldn't be fearful of being able to do that by harming yourself, because I mean, what we do is help people safely get back to what they used to do and then be able to achieve whatever goals they want to.
And I think sometimes patients don't actually think about what their goals are.
Yes.
You know, and starting that conversation with them to say, okay, well, let's look at some short-term goals, but let's look at the bigger picture here. Like, there's a lot of living to do out there. So if the short-term goal right now is I just need to get my nausea under control, then let's go ahead and focus on that. But like you were saying, the bigger goal and the bigger picture, I think that's something that people don't actually talk to their practitioners about. So as a practitioner, if you don't have those discussions, you kind of have to figure it out on your own. But by just having open dialogue, it makes such a huge difference.
I think we have the time to do that, to talk with our patients. Whereas a lot of doctors, I think, they're on schedules.
Right.
So we're very fortunate here where it can be relaxing. It's, healing, and people come in here and they don't want to leave because it's so comfortable.
Right.
I had a client who had neuropathy, very, very severe in her feet, and her goal was to play golf with her grandchildren, and she finally did. But it took, weeks and weeks and weeks, and
months sometimes,
months, years,
and years. Yeah.
I mean, and she was also very, very hesitant about coming to me because she didn't want to be touched.
Sure.
And I think people are a little bit hesitant of touch, but once they see that it's not going to be painful. It's not a frou-frou kind of thing. It's not ticklish. It can be very effective, and it can do so much for the immune system, for that oxytocin hormone to kick in, for people just to relax. And I think nowadays we almost need permission to relax.
Right, that is so true.
And I know I have clients coming to me who are past treatment. They're in survivorship right now, and they're stressed because they're back at work.
Right.
And work is stressful.
Right.
And their pace just doesn't stop. And they come to me, and it's like, I need to relax. So many times I modify the massage just for that one session, but each session is customized. And we do achieve that. And if I can give them a little pillow, more or less, of relaxation and comfort to help them get through, everyday stress, then I feel then I have succeeded. And by them coming here and working with Agnes and with Angela, we just offer this team effort, which is this integrative thread of collaboration and community.
Right.
And that's so important because I think healthcare practitioners tend to be alone, tend to work alone.
Right. I think we inherently want to work with other people.
Absolutely, yes.
But it's finding other practitioners who share your vision and whom you trust. That's the hard part, and making sure that you're finding somebody who's actually trained in your specialty.
Right. Well, going back to the new norm and going back to patient goals, I know that with some clients you were speaking about golfing. I have actually gone out back with someone and worked on their golf swing to do it correctly for their new body and correctly for what they're dealing with. Or going out back and helping someone learn how to appropriately put their child in their back car seat.
I've noticed that when people go through all of their treatments, the first thing they want to do is do a detox, or all of a sudden they want to start taking all these supplements. And I get really concerned when patients are wanting to do that on their own. And I think the reason they want to do it on their own is because they just don't know where else to turn. And my approach has been to make small changes that are lasting. It's not a competition of how many pills you can take in one day.
Right.
Sometimes people feel that way, right? Where they have all these pills and these supplements that they have to take. But what I think we do here is staying with that patient for a longer period of time, making small changes that are now implemented to new habits, right? So let's just walk this week outside for 10 minutes. You don't have to get on that treadmill for 45 minutes every single day, because we know that in this particular group of patients, we have to implement things a little bit slower, that's safer. And again, I feel like so much of it just comes down to patients not having a place that they can ask these questions to.
And having long-term follow-up as well. I mean, we see people for some time and then we don't just discharge them.
Right.
We follow up. We're there for them through the entire journey.
That's right.
And through their entire lifetime whenever they need us.
Yeah, and it's not uncommon for people to get better with whatever it is that they're coming to see us for. So maybe we've been treating them for a month, maybe 3 months, maybe 6 months. And then I typically say, we're done for a little while. We've met some of these goals. Just go out and come back to me when something else comes up. And that they know that they have somebody that they can come to that knows their history, that can help them with whatever the next thing might be, because inevitably there will be something else that they need some assistance with.
Yeah.